Well, the contraindications actually are based on a lot of common sense. What have been the contraindications for ACEI, we probably continue. Somebody has a strong angioneurotic diathesis, probably one would be contraindicated, or a known hypersensitivity to ARBs, one would be reluctant to use. But the real contraindications are the eGFR less than say 25 or so. That is where definitely ARNI will be contraindicated. If the liver function is grossly distorted, mild and moderate probably you can continue, but remarkably reduced deranged LFTs, one would be thinking twice of using ARNI along with it. If pregnancies and breastfeeding, they are still not known areas, so one would not venture in there. Pregnancy, of course, it will be a complete contraindication. If somebody is on ACE inhibitor and has got angioneurotic edema, these are the patient who one would be very careful, but we can still introduce ARNI to them. So these are all contraindications, as I said, which are based on common sense. And if we keep a good vigil on this, probably you can introduce ARNI to most, and the obvious contraindications will be followed. About 18% patient develop hypotension, and drug has to be withdrawn related to ARNI. There could be worsening of GFR in about 3% patient, persistent hyperkalemia in a smaller number of patients. These can happen. Person who has a bilateral renal artery stenosis is a contraindication for ARNI. Person who is on oral contraceptive pills is a contraindication for ARNI. Lithium use also is a relative contraindication because it can increase the lithium toxicity. So these are the things which are in small letters. One has to do extra reading for understanding these contraindications.